for people who are diagnosed as sick. What's been puzzling people or causing people some consternation or questions is how can they take these same rules and apply them to people who are healthy or haven't been diagnosed as sick? Well, as the pandemic has gone on, we've certainly known for at least 2 weeks before somebody shows symptoms, they may be ill and contagious. There is now information from another country, and I don't know whether or not it's true, so I'm not going to quote it extensively or anything. But there is some evidence that it can be contagious as much as 24 days before showing symptoms. So, of course, they're taking it a lot more seriously now, governments. And like in a time of war, governments have a broad ability to, take care of the population and the population's health. And so the theory behind ending what we like to consider our freedoms to come and go as we please or choose whether or not to wear a mask is that we don't know who's sick and who's not sick. We don't know who's contagious and who's not contagious. So based on that, it makes sense. There is a rational basis, is what it's called under the law, the term for making laws and regulations like this. There's a rational basis for regulating everyone because there is evidence that for at least 14 days, people can be sick. And this is a contagious fatal illness, which is airborne. And so, under those circumstances, the government and the courts are allowing a lot more leeway than they normally would allow in the public health situation. We've had public health epidemics before where the virus, for example, HIV, is not contagious in the way that coronavirus is. You need a lot of close contact with someone to get HIV. So they did not make these kinds of draconian laws that they're making for coronavirus, but they still did contact tracing and things like that. So anytime you have a widespread contagious illness, the law does do contact tracing for people who had the kind of contact with a sick person, a person who has been diagnosed, that they're doing now. The difference now is that it is so incredibly contagious that the contact tracing is much more widespread, and more people who are potentially ill are being asked to self isolate, and they're putting more and more teeth behind this. So when it first started, Governor Cuomo in New York State, anyway, had put out a lot of executive orders, and there was some real question as to whether or not he had the authority to do that, especially against healthy people. But now the legislature has caught up, and he does have the authority to do that. And under the health law, there are some new health laws that have been passed. There are some new powers that federal and state actors have been given. And so the bottom line is that we really need to obey these laws or we may face some kind of prosecution. And you really don't want to get a criminal record because you weren't obeying a quarantine and because you had a mistaken idea about whether or not they could do this. The courts have very much backed the government's ability to do this to save lives. Like I said, in the same way that they would um, have the ability to do this if there were a wartime, if they were trying to save you from an invading army. They are very much able to try to save you and others if you don't, particularly care about yourself. They have the power to save people from this virus. So the most recent one, Public Health Law 2100, gives broad authority to local boards of health and health officers to deal with outbreaks of infectious diseases like coronavirus. So every local board of health and every health officer is ordered to guard against the introduction of communicable diseases as are designated by the sanitary code and in the declared public health emergency. So our local health officers have a mandate to try to prevent these infectious diseases from coming into our communities. So it's not just something that they can do, it is something that they are ordered to do. And they're supposed to do this by the exercise of proper and vigilant medical inspection and control of all persons or things infected with disease. And that applies to people who may be infected or have been exposed. So when it says all persons, If you have been in contact with someone who has COVID-19, certainly you are part of all persons who may have the infectious disease. And since jumping back to what I said earlier, since we don't know who is infected and who's not affected, the all persons really does cover all of us. So if they tell us that we need to wear masks in public, then we need to wear masks in public. The other things that they're mandated to do is to provide for the care and isolation of cases of communicable diseases in a hospital or elsewhere when necessary for the protection of the public health. So what does that mean? That means essentially if you refuse to quarantine or isolate, they can take you away to and elsewhere, and you can be kept there for as long as they think you need to be isolated under the law. So they can actually come and pick you up and take you away under this public health law and keep you in a hospital or elsewhere. And it just says elsewhere. That's what the law says. It doesn't say, what kind of conditions they have to be in elsewhere. It doesn't say whether it's a hotel or a jail or anything else. It just says they can take you elsewhere and make sure that you quarantine. Another part of that is they can prohibit and prevent all going on in what they call infected premises, all places and things at the infected premises. So what does that mean? That means if you are a business or a store or even a home, but let's talk about businesses and stores, and somebody had COVID-19 there, and there isn't mask wearing, there isn't social distancing, they can consider your place an infected premises, and they can shut down your business with just on the basis of you're an infected premises. And how long are you infected premises for? Well, it doesn't say how long you're an infected premises for. So you can actually be shut down as a business if you're not engaging in the social distancing and making people wear masks. And that's a pretty powerful authority under the public health law. They also require doctors, hospitals, laboratories, hotels, lodgings, and others to report diagnosed cases of infectious diseases to local health officers. So think about that. I mean, it makes sense that a doctor or hospital has to report infectious diseases, but they're talking about hotels and others, and it says, and others. So if you know about an infectious disease that somebody's trying to hide, in theory, you're supposed to be reporting that to the government so that they can under Health Department Law 2103, the local health officers can fill out their reports and let the government know how widespread this infectious disease is. And so Public Health Law 2120, we're going to talk about when we get back, that authorizes them to take care of dangerous and careless patients right after the break.
We'll be right back with Law Talk here on the Patriot.
It's a little scary, isn't it, Frank?
What's that?
I said, that's a little scary, isn't it, Frank?
Yeah, no kidding. It's nuts.
It is.
It's kind of funny that you're talking about this because the guy called right towards the end of my show and was explaining how his fiance had to go through the whole process of quarantine because she was coming from Georgia. It was interesting.
Right.
I thought that it was, you just had to fill out the form if you flew. I didn't realize it was even if you're driving.
Right. And I think some people don't understand that, and they may pass through an affected state and not realize, well, you're not supposed to go anywhere or do anything for 14 days now.
Yeah. I mean, no one can do, there's no tourism around here because who's going to come for a 3-week vacation?
Right, exactly. And the first 2 weeks, you have to stay in your hotel.
Right, exactly. All right, 30 seconds.
Okay.
All right, so your rejoin just started. I'll let you know when you're on.
Okay.
Okay, go ahead.
And welcome back to Law Talk. And today we're talking about public health laws that can control your life, let's say, because of the COVID-19 virus. And some of these are old public health laws back from the flu pandemic in 1918. Some of them are related to tuberculosis, but there have been a whole lot of new ones that have been passed and strengthened, not only here in New York, but across the nation. So now we're going to talk about Public Health Law 2120, which is a New York law. And it says, whenever a complaint is made by a physician to a health officer that any person is afflicted with a communicable disease or is a carrier of, various assorted communicable diseases, and then it says, or other communicable disease, so really anything, in COVID-19 is included, is unable or unwilling to conduct himself and to live in such a manner as to not expose members of his family, the household, or other persons with whom he may be associated. The health officer shall forthwith investigate the circumstances alleged. Okay, so they have a right to even come into your home and check out whether or not you are behaving properly as far as not infecting family members. So some people might find that surprising because, hey, that's your home and usually the government can't come in without a warrant. But a public health officer can come in and check and make sure that you're doing what you need to do to keep your family healthy and safe. And so if they find that you are what they call a menace to others, then they file a complaint against you, the magistrate, and on such complaint, said person shall be brought before the magistrate, which would probably be virtually. And the magistrate, after a hearing, would be able to take you and put you as a source of danger to others, to commit you to any hospital or institution established for the care of persons suffering from such communicable disease, or maintaining a room or ward or wards for such persons. So now, some people have been sent to hotels, so that the hotels have been largely empty because of the tourism issues. So they have turned hotels into wards for COVID-19 people. As you know, there was a U.S. Navy ship, there was a tent in a park in New York City for care of people. And so they can actually make you go there, is what I'm saying, is it's not just all voluntary. They can make you go and stay someplace safe if you don't follow their rules in your home. So if you are given the opportunity to self-isolate at home and they give you rules and regulations as to how to do that safely, you need to follow those rules or regulations. Because there's another law, it's Public Health Law 2121 to 2122, and both of those sections spell out the duties of a patient to comply with all of these rules and regulations of the hospital where they've been committed, of the magistrate's order, and of the orders of public health authorities. And failure to do so results in the patient being placed apart from other patients, so you can actually kind of be put in solitary in the hospital or wherever they are. And if you willfully violate the rules and regulations there, or conduct yourself in a disorderly manner, so you're trying to escape or whatever, the chief medical officer of the institution can order that you be taken before a magistrate again, and then they can confine you for up to 6 months just as punishment for not cooperating. So it's not just that they can take you away and put you wherever they basically want to put you, that they call a ward for care of people with COVID-19. But if you don't cooperate with that process, you can get 6 months in jail. So, really you want to cooperate with these sorts of things because it's temporary, it's for yours and everyone else's best interest, and you can go to jail. And again, you've always been able to be arrested for recklessly endangering other people. The difference now is that they are applying these laws to people who have not shown any signs of COVID-19. And the reason for that is that we just don't know who has it and who doesn't, because it is contagious long before, anywhere from 14 days, now we're being told maybe 24 days before symptoms show. So there is definitely a rational basis under the law for the government to do this. And that is really all they need. So governments, when they are making new laws that restrict our freedoms, they have to have a rational basis, and it has to be under clear and convincing evidence. Well, it's clear and convincing that people are dying from COVID-19. It is clear and convincing that people are contagious before they know they're sick, and there's a rational basis, that is to save lives. So they can do this. So there's been a lot of talk about, your constitutional rights are being violated, and again, constitutional rights have restrictions all the time. Like, the classic, you can't yell fire in a crowded theater because that endangers people unless there's actually a fire. Because, people can get trampled to death. That's happened. So your constitutional rights can be restricted. Now, Another question I get is, well, all those peaceful protesters out there, they're not, a lot of them aren't wearing masks, they're not observing social distancing. And I just have to tell you that prosecutors have what we call prosecutorial discretion. They do not have to arrest everybody who violates a law. It's up to the prosecutors who they prosecute and who they don't prosecute. And I don't know why some people aren't being prosecuted and some people are. Perhaps they think that this lack of social distancing will be its own punishment when people get sick. I don't know. I don't know what the theory is behind that. All I know is that these laws do apply to you, even if they don't seem to apply to other people, and that you don't get to pick and choose the laws that you follow. It's the district attorney who gets to pick and choose who they'll prosecute. And that's because they can't prosecute everyone, and they're allowed to take circumstances into consideration. And, a lot of prosecutors have taken into consideration the circumstance that people are protesting for their rights, and they've decided not to prosecute. And we can't change that, and it is not an argument, not a legally supportable argument anyway, for you to not do what you're ordered to do by the public health authorities. So in the case of, so similarly, and now a lot of these other rules that are new and that have been being made are found not in the public health law, but in the New York Code of Rules and Regulations. So that's a different set of laws, and basically these are regulations that implement laws that have been passed, but they're more detailed. So the Code of Regulations the New York Code of Rules and Regulations has the force and effect of law, even though it wasn't specifically passed by the legislature, because it's considered implementing what the legislature passed and clarifying, making clear how that's going to happen. So under the New York Code of Rules and Regulations 2.29, it authorizes a health officer, when in the case of a highly communicable disease comes to his attention, to order the isolation of the affected individual as in his judgment they deem necessary. So basically they can do anything they want. They can tell you, and people have been told, you have to go to a hotel and stay in a hotel room and isolate yourself and just get food delivered, unless you have a place in your house where you have a bedroom that's got access to plumbing, so that you can actually stay just in that bedroom and use that bathroom and not go out among other people in your house. And they can make you do that in your own house. And so it's whatever they deem to be necessary. So it can be at your home, it can be the hospital. They can order you to be moved to a suitable hospital, and it doesn't matter if you want to go or not. You have to go. So there's a whole lot. If you want to look at New York Code, it's 10 NYCRR Chapter 1 Part 2, and it's in the State Sanitary Code, it's called. So the State Sanitary Code is some part of the implementing rules and regulations for the public health law. And we're going to take a break, and we'll come back and talk some more about that in a Law Talk.
This is Lisa Stofan. Heard the Mark Patrick weight loss hypnosis hype? Well, I attended.
We've got about a little over a minute.
Okay, thanks.
All right, your rejoin is just starting now.
Okay.
Okay, go ahead.
So we're back with Law Talk, and we're talking about the new laws for COVID-19 in New York State and across the nation. And I want to make sure that I'm clearly telling you the things that are going on and what they can do. And so that the local health department can now issue quarantine orders, and they're enforceable. So I talked a little earlier about being brought before a magistrate, but that's only because you violated them or you refused to cooperate with the orders. Don't be confused and think they have to take you to a magistrate before the quarantine order takes effect. They have full authority to issue quarantine and isolation orders. So the isolation order would be for self-isolation, and then the quarantine is a little more severe. The isolation is basically because they suspect you might have the coronavirus or some other communicable disease, and the quarantine is that they're sure that you do. But the fact is that they can tell you to stay to yourself and not have any contact with other people, and that is perfectly legal. And again, the courts are completely supporting these laws. They do have a rational basis. There is clear and convincing evidence, and those are the standards that they need to meet. So one of the things, I've got a whole lot of notes here, but I want to make sure that I hit the highlights before the end of the show today, is that they can keep you in detention for up to 3 days before you even have the right to ask for a hearing. So if you're being held involuntarily on COVID-19 reasons, they don't even have to let you ask for a hearing for 3 days. So that's something to know. Another thing is that among the many places that are required to report suspected cases of COVID-19, and it's not terribly surprising, but it includes schools. So if the children go back to school this fall and any of them have any of the symptoms of COVID-19, which is essentially anything. I mean, they say runny nose, diarrhea, cough, all kind, fever, fatigue, all kinds of things. If a child has any of these symptoms, somebody's going to have to sit down and write a report, and they're going to have to send that to the health department. And this is only a small part of the reason why they're talking about not sending kids back to school, because just the paperwork burden, never mind trying to get little children not to touch each other, not to touch their faces, to wear their masks all day and keep 6 feet apart. I mean, you can't even keep kids in a straight line in school sometimes. Try to keep them 6 feet apart. So these are serious issues, because not because children are terribly affected as an enormous group by COVID-19, although some children have died and some children have had some terrible complications, but because children have parents and grandparents that they presumably go to see, and they can bring the disease home to, and it can be terrible threat to public health and a terrible threat to their families. So there are all kinds of reasons why they're talking about not sending kids back to school directly. So they have an article here now in New York City where it is much, much broader. So they can do pretty much whatever they want as long as they even suspect you have the illness. And they have a whole section on police power and limitations. So if you're going to New York City, or you know anyone who's in New York City, that is in the New York City Code, the Health Code, Section 1117, Police Powers and Limitations. And so New York City has more strict regulations on COVID-19 and on health codes than the state does. And that's something that counties and towns are allowed to do. You can't be less restrictive than the state, but if you want to be more restrictive than the state, and you have a rational basis and there's clear and convincing evidence, they can make these laws. I remember reading quite recently that somebody, some town somewhere, reminds you of the movie Footloose. They had banned dancing, not for religious reasons, but for COVID-19 reasons. And so they, it's amazing how much they can actually do, get away with, and it has the effect that